So what we're going to do is we're going to start freezing anteriorly to posteriorly. We don't want to freeze posterior first because the dense ice will block our ultrasound image. So we're going to freeze anteriorly to posteriorly. Let me get you a good transverse image here. Anterior to posteriorly. We're going to start with probes 1 and 2 first. And so the probes run on a freezing cycle of 10 seconds. And so if you have a probe on at 100%, the probe will be constantly running throughout the 10 seconds. We are actually going to have probes 1 and 2 on at 35%, meaning 35% of that 10 seconds, the probes will be on freezing, and the 65% of that 10 seconds, the probes will not be freezing. So again, this will give us a nice, gentle, controlled freeze anteriorly. Typically, so we're going to 35% anteriorly, right. Typically, I'll only freeze anteriorly at the max maybe 5 minutes. I do that because anything greater than 5 minutes, you may affect the dorsal vein and actually cause a fair amount of penile swelling. Also, if you freeze even well longer than 5 minutes, you can freeze into the pubic bone, and the patients can have pain there in the pubic bone, which can be fairly intense. So, it's the left side that we're sparing. So again, we have probes 1 and 2 going. You'll start to see the ice formation here very soon. Typically, we'll start probes 3 and 4, the next probes to go, when the ice is approaching 3 and 4, or if we see the temperatures on probe 3 and 4 changing, letting us know that the ice is getting close to probes 3 and 4, since these probes can sense the change in the temperature. And you can actually see that here now in maybe in probes 4, where probe 4 is already down to -7 degrees Celsius. So again, letting us know that probe 4 is sensing the temperature from probe 2. And we can probably turn probe 4 on if we can see it, the temperature continue to decrease. Probe 3, which is on the right side of the gland, is still at 16 degrees.